How do electrolytes affect bladder nerve control? Have you ever wondered how the minerals in your body influence bladder control? Electrolytes play a vital role in how our nerves communicate with our bladder. These electrically charged minerals, such as sodium, potassium, calcium, and magnesium, are essential for the proper functioning of nerve signals that control bladder muscle contractions. The bladder is controlled by a complex system involving both the autonomic nervous system and somatic nerves. The autonomic nervous system has two parts, the parasympathetic and sympathetic nerves. The parasympathetic nerves are responsible for stimulating bladder emptying. They activate specific receptors on the bladder muscle, known as the detrusor muscle, causing it to contract and releases urine. On the other hand, sympathetic nerves help the bladder fill by relaxing the detrusor muscle and tightening the internal urethral sphincter. For these nerve signals to work effectively, electrolytes maintain the electrical gradients across nerve and muscle cell membranes. This balance is crucial for generating action potentials, which are the electrical impulses that allow nerves to fire and muscles to contract. Sodium and potassium ions are particularly important in this process. When sodium enters nerve cells, it initiates the action potential, while potassium exits to help the nerve cell return to its resting state. Calcium ions also play a role by aiding in the releases of neurotransmitters at nerve endings, which helps communicate signals between nerves and bladder muscles. Magnesium is essential for regulating nerve excitability and muscle contraction. When there is an imbalance in these electrolytes, it can disrupt nerve signaling. This disruption may lead to bladder dysfunction, such as overactivity, underactivity, or issues with the coordination of bladder contractions and sphincter relaxation. Maintaining a proper balance of electrolytes is especially important for bladder health, particularly for individuals with neurological conditions or those undergoing cancer treatments that may affect nerve function. Proper hydration and electrolyte management support normal nerve and muscle function in the urinary system, which is crucial for both bladder emptying and continence. In summary, electrolytes significantly influence bladder nerve control by enabling the electrical impulses necessary for effective communication between nerves and muscles. Keeping levels of sodium, potassium, calcium, and magnesium balanced is essential for healthy bladder function and overall urinary health. If you have concerns about your bladder health or electrolyte balance, it is always best to consult with a healthcare professional for personalized advice.